Everyone has a loved one or a friend or a coworker that has experienced problems with alcohol or drugs, or experienced depression, anxiety, or more serious mental illnesses. So it really does touch everybody.
When you need help, you need help. Everybody can recover. It shouldn't be different for folks with a disability. They should be able to live in the community and have the support that they need. So that really is our mission.
And that's worked over the last 50 years for us, and it's been a consistent theme that's allowed us to continue and grow and be where we are today.
Henrico Area Mental Health and Developmental Services provides a host of life-changing community-based services for the 360,000 residents of Henrico, Charles City, and New Kent counties. With a dedicated staff of nearly 400, the agency now touches the lives of some 10,000 individuals each year through its comprehensive mental health, developmental disability, early intervention, and substance use services. As it marks its 50th anniversary in 2019, the agency can take stock in its efforts to help individuals lead full and productive lives within their community. That modern-day mission stands in sharp contrast to the mental health field's approach and the services available to individuals in the mid-20th century.
Well, prior to the 1950s, 1940s, state institutions were really the primary, if not the only, service available for individuals with serious mental illness and those with intellectual disabilities. At the high point, nationwide, there were almost 600,000 people in state hospitals and almost 200,000 people at the peak in the state training centers nationwide.
There were places where people went to live and stayed very often for the rest of their lives. They received very little treatment. Conditions varied from state to state and hospital to hospital, but it was not a very meaningful life for folks.
It was during that time that the early psychotropic medications were developed that enabled really the controlling of the symptoms of those serious mental illnesses. And it was those symptoms that required hospitalization. It was not the diagnosis.
That really enabled many more people to live successfully in the community. But it took a while for attitudes to change too, and in the 60s there really was a push to develop community services as an alternative to institutions.
Putting some muscle behind that push was the Community Mental Health Act of 1963. The federal legislation was designed to provide funding for mental health centers and services on the local level, and led to the closing of many state institutions.
The significance of the legislation at the national level that was signed by President Kennedy is that it signaled a change from institutional care to community care. It was in the early 1960s that the Virginia legislature began to fund what were called mental hygiene clinics. And there were a number of those around the state. They were developed to provide medications for the individuals who were discharged from the state hospitals.
The folks from Henrico at that point were either going to private practices or to the city of Richmond. Henrico didn't have any mental health services. So a group of women from the Thomas Jefferson Jr. Women's Club banded together and decided they were going to make a difference for the individuals who lived in Henrico County. So in 3 weeks, so the story goes, is that they put together a budget and they got approval both from Henrico County Board of Supervisors and the General Assembly.
The mental health clinic was first funded in 1968. The initial funding from the state was $21,400. There was a part-time physician in that early staffing and one clinician, and they were housed in the Bryan Cottage, which was on the grounds of Westbrook Hospital, which no longer exists, and that property has been taken over by Westminster Canterbury.
Well, it was certainly shoestring. And I think what was different too is that it did not rely on federal money to get things moving, that it really was a grassroots movement.
For me, it really showcases the beginning of advocacy, which is so important in our field because there's been, so much stigma associated with mental health and just the advocacy. So it's small groups of people that have really banded together that have made a difference in our field. And these women made a difference for Henrico County.
They weren't in it for anything other than helping other people.
Here we are 50 years later, a fantastic organization. It's pretty remarkable, the power of what people can do.
Those initial determined efforts quickly began to bear fruit. With funding in place for Henrico's first clinic, the Board of Supervisors established the Community Mental Health Services Board in June 1969 to administer the provision of services. Charles City and New Kent counties were included in the agency's service area in 1971. Programming began to expand as well. Developmental disability and substance use services were added in 1971 and 1977, respectively.
I arrived in Henrico in September of 1977 when the offices were located on Landmark Road. They had moved there from the Bryan Cottage in 1974, but to accommodate the expanded staff, they had moved to the larger quarters. When I arrived, there were 18 mental health staff and even fewer developmental disabilities staff.
We were a smaller organization, and you knew everyone's name.
And then from then, the agency grew pretty quickly. Historically, the agency has been in the forefront in the state when there was a new need demonstrated. We didn't wait for leadership from downtown. We tried to make things happen with the resources that we had. We've always had a really high quality, dedicated staff. People were able to do quality work, be mission driven, and be collaborative with each other and have a pretty good time doing it.
The growing agency and its staff received a significant endorsement from Henrico residents in 1976. That year, county voters approved funding for construction of the first county-owned mental health facility.
That was 1 year before I came, and we began the design of that building in '77.
That allowed much better interview space, group therapy space, allowed observation of sessions for supervision and for quality control, had a dedicated emergency services area, so it was a huge step up. The agency grew a lot during the 80s and 90s.
We started a lot of services in residential and case management and day programs, and we've had great support from the county and the state that allowed us to do those things. Our needs change, and we have to be able to meet the needs of a changing environment.
As the agency has innovated and adapted to meet the needs of clients, it has also refined its philosophy.
It used to be that mental health issues or developmental issues, that kind of what you had defined who you were, and so you were identified by whatever your diagnosis is. We changed our language, which is tremendous, so it's much more supportive, much more empowering, that this is an individual with a disability. It doesn't define who that individual is. So that's been a tremendous change. We have to treat the whole person. So we've been able to add primary care to our services, and what that has helped us to do is really to save people's lives.
Henrico Area Mental Health and Developmental Services cut the ribbon on the new East Center in June 2019. The state-of-the-art facility will further enhance the agency's efforts as it continues its mission to serve the people of Henrico, Charles City, and New Kent counties.
The organization wanted to celebrate the 50th anniversary because we are proud of our past. We've had a lot of accomplishments, and we are still in the process of continuously improving and meeting our future needs. So it's nice to pause and look at where we have been and understand where we need to go to continue the great legacy that we've developed.